This is Stigma, where we talk with leaders from many industries about how mental health and addiction have impacted their lives. Many people suffer silently from mental illness, addiction, depression, anxiety, and trauma. They never seek help because of stigma. In this podcast, host Stephen Hayes and his guests share their stories of recovery in order to encourage others to do the same. Here's Stephen.
Welcome back to another episode of the Stigma Podcast. I'm excited about today's guest, Dr. Chris Palmer. He's currently the director of the Department of Postgraduate and Continuing Education at McLean Hospital in Massachusetts. He's also an assistant professor of psychiatry at Harvard Medical School. Dr. Palmer received his medical degree from Washington University, and he did his internship and his psychiatry residency at McLean Hospital, Massachusetts General, and at Harvard Medical School. He is a practicing clinician. He focuses on treatment-resistant cases. He's been doing that for over 20 years in psychiatry. Most recently, he's been doing research on the interface of psychiatric disorders and metabolic disorders, such as obesity and diabetes and cardiovascular disease and just broader inflammation. And he's been doing that to better understand what's causing mental illness and to develop better treatments. He's also pioneering the use of the ketogenic diet in psychiatry. There's a number of ways to connect with Dr. Palmer and to learn more about his research. He references a lot of resources in this episode, so we'll link to all of those as well in the show notes. But without further ado, Dr. Palmer, thank you for coming on, man. I appreciate it.
Yeah, no, thanks, Stephen. Thanks for having me on.
You know, it's like for me, I've struggled with bipolar. I'm fascinated by your work. I'm really grateful to get to have this conversation. And I just wanted to start with the $1 million question, which is, what's the connection between the ketogenic diet and mental health?
So that is $1 million question. And, it's interesting because there are a couple of different ways to look at it and go about it. The easiest one for most mental health clinicians is the overlap between treating epilepsy and treating psychiatric disorders. So any mental health clinician who prescribes medication or sees medications prescribed to people kind of already knows that we commonly use anticonvulsant medications, which are medications that stop seizures. They're used to treat epilepsy. We use these routinely in psychiatry for a wide variety of disorders. So those medications include names like Depakote, Tegretol, Lamictal or lamotrigine, Topamax or topiramate, gabapentin or Neurontin, but it also includes all of the benzodiazepines. So those are medicines like Valium, Xanax, Klonopin, Ativan. Exactly what disorders do we use all of those medications for? We actually use them for kind of almost everything in psychiatry. They get used in patients with all sorts of different diagnoses, ranging from bipolar disorder to depression, anxiety, eating disorders, even alcoholism. We use those medications to detox people from alcohol, but we also use them in their maintenance treatment to treat, insomnia, to treat anxiety symptoms, also sometimes to treat cravings for alcohol. Some medications like gabapentin or topiramate have actually been studied for those reasons. And so for some of your listeners who don't know, the ketogenic diet is, although it is a trendy fad diet right now, or a lot of people think of it that way, it's actually been around for about 100 years. We're in the 99th year now. It was first described by a physician in 1921. And it was developed specifically to treat seizures. And it is still in use today. And it can stop seizures even when lots and lots of medication trials failed to stop seizures. It can even sometimes stop seizures even when surgery doesn't work. And at this point, we have a tremendous amount of evidence that the ketogenic diet is an effective and safe treatment for epilepsy. And so in many ways, my using it in psychiatry is actually kind of commonplace. And when I put it this way to most clinicians or even patients and families who've had a long history with the mental health field, and I describe all those different medicines that are used, they were developed for epilepsy, and we use them all the time in psychiatry, they're kind of like, oh, well, wait, if yeah, if all those things kind of work for psychiatric disorders, why hasn't somebody started using the ketogenic diet if it in fact is an evidence-based treatment for epilepsy? Why is psychiatry so late to this kind of field?
Why is that? I mean, I know we've spoken about this before. I know there's a lot of research on this. Pharmaceutical companies have looked into this. It's been used for 100 years now. Why is it not more prevalent as a treatment, as a medical treatment versus just as a diet?
So I think, one of the big, I think there are a few obstacles. So one is that most people and even most medical professionals are not aware of the abundance of evidence in favor of this diet. They're not aware of the basic science evidence, both in animals and in humans. They're not aware of the clinical evidence that this diet really has been tested in randomized controlled trials in people with epilepsy and has been shown to be effective. So most of the people not being aware of this evidence, when they hear a diet can treat epilepsy, they're immediately skeptical. And I think they're skeptical for good reason, because the reality is when you get into the field of dietary science, there's so much disagreement about what foods are healthy, what foods aren't healthy. But there are also so many kind of frivolous, quackish claims out there about, oh, this diet will cure everything. Oh, that diet will cure everything. And so when people hear the ketogenic diet can stop seizures, most people are like, oh, that must be one of those quackish, frivolous claims. But the reality is, any medical professional who wants to Google this or do a PubMed search looking at either basic science or clinical evidence, there is a tremendous amount out there. And so I think, obstacle number one is just skepticism about a diet being an effective treatment for really serious disorders. I think most people believe and agree that a quote unquote healthy diet can make people quote unquote healthy. But when you're talking about really serious disorders, like epilepsy or like schizophrenia or bipolar disorder, people are like, no, a diet's not gonna do anything for that. So I think that's obstacle number one. The second biggest obstacle is that a lot of people can't do this diet. And there aren't that many professionals, certainly not in the mental health field, but even in neurology, surprisingly. There aren't that many professionals who really fully understand this diet and how to get people to do it and how to get people to do it appropriately and how long it takes to work, because this isn't a magical cure. It's not like you do it and 2 days later you're completely cured. This is just like any other treatment. Medications can take, sometimes, 2 to 4 weeks to even begin to show a hint of working, and then they can take 2 or 3 months sometimes to really fully work. Well, guess what? This diet's kind of in the same boat. This diet can take time to work. And it's a really difficult diet to do for most people, especially in the first week or two. And so, because clinicians are skeptical about it anyway, and it's really difficult to get patients to do it, and it takes a while to work, I think those are probably the biggest obstacles out there.
And when we say that it helps people who have these disorders, can this diet cure these issues in the brain, or is it masking the symptoms? Is it just is it slightly making improvements? When we talk about using keto to treat someone with a serious mental illness, are we talking about curing permanently or just sort of masking symptoms, or how do I think about that?
So it's a great question. And I think, at this point, in the mental health field, I would say I am not aware of even one person that I would use the word cure for. And the reason that I say that is because in order to use the word cure, you really have to, like, an antibiotic can cure an infection. And what I mean by that is that people can have an infection, even a really serious one. They can take an antibiotic for a while, but then they can stop that antibiotic and the infection is gone. It is done. It's not going to come back if you fully treated it with that antibiotic. And so antibiotics can sometimes cure infections. With this treatment, there are reports and actually quite a few people in the epilepsy world who have done this diet for anywhere from like 2 to 5 years. It sometimes can completely stop their seizures, but sometimes it just reduces their seizure frequency. And for some people, it doesn't work at all. So I just want to put that out there. And usually the rough statistics are like 1/3, 1/3, and 1/3. So 1/3 of people will seemingly have almost a complete resolution of their seizures. They don't have any more seizures. Another third will have a significant reduction in seizure frequency, but they continue to have seizures. And then another third, it doesn't seem to work for them. But in the epilepsy world, among the people who get a benefit, so that 2/3 category that either have a significant reduction in seizures or complete stopping of seizures, a lot of those people are able to stop the ketogenic diet after 2 to 5 years and maintain the benefits that they achieved. So, for example, kind of a quote unquote poster child for this treatment is a man named Charlie Abrams. He was 2 years old when he started the ketogenic diet. He had treatment resistant epilepsy, was having numerous seizures every day. And he was on the diet. He had complete resolution of his seizures with the diet within 4 days. And he stayed on the diet for about 5 years. And he stopped the diet after 5 years. He's not even on a modified ketogenic diet. He's on a regular standard American diet and is now in his 30s and has remained seizure free ever since then. So some people want to use the word cure for someone like him, but other people argue, well, maybe he grew out of his epilepsy. Who knows? Yeah, we really don't know. So in the mental health field, among all of the people that I personally am aware of who've had serious disabling psychiatric disorders, and I've published about a couple of cases. One woman who had chronic paranoid schizophrenia for 53 years, and her schizophrenia went completely into remission. And she is off of antipsychotic medicines and has been off of antipsychotic medicines for 13 years now and has remained in complete remission from her psychotic disorder. Yet the confound is that she remains on a ketogenic diet. So given that she remains on a ketogenic diet, we can't really necessarily use the word cure, but we can certainly use it's an extremely effective treatment for her, especially compared to the other treatments she had tried.
You mentioned some of these folks being on this diet for years. We talked about 2 to 5 years. We talked about, and when we've spoken before, you've mentioned, of people that have been on it for decades. I read a lot of what I think might be misinformation out there about the keto diet and about how you can't stay on it very long. It might be poisonous. Can you talk to us a little bit about the duration of time that one can be on this diet in a healthy way?
I think the first issue is that there are lots of different variations of a ketogenic diet. So and not all of them are interchangeable, and they're certainly not the same diets necessarily. So there are different levels of the medical version of the ketogenic diet. There are weight loss versions of the ketogenic diet. There are some versions of the diet are highly even more restrictive than other versions. So there's a version that some people call the carnivore diet, which essentially excludes all plant-based products. So any plants or plant-based foods are eliminated. And so I think question number one, or issue number one to first think about is, well, what version of the ketogenic diet are we talking about? The second issue is, why is the person on the ketogenic diet? And so I would say, if you are someone with epilepsy and you had 20 or more seizures every single day, and you were completely, utterly disabled by your illness, you were probably unconscious most of the day. I know of people like that who are nonverbal. They're completely nonverbal. And so they're completely disabled, nonverbal, not able to learn, not able to interact, not able to care for themselves. If the ketogenic diet stops that person's seizures and allows them to function in society, I would be the first to say, as a physician, it would be really foolish for anybody to try to talk that person out of doing the ketogenic diet for health reasons. Because the reality is, the consequences of having severe disabling epilepsy are dramatically worse than anything that the ketogenic diet is going to do over the long run. The reality is that the fact that we do have some long-term data. So we have some data from a clinic called the Verta Clinic, and they treat people with diabetes who are obese, so type 2 diabetes. And they have been doing a study for over 3 years now, and they have over 300 people on a ketogenic diet. So this is more of the kind of weight loss diabetes version of the ketogenic diet. It's really not the epilepsy version. But they've had people on this diet for 3 years. And a significant number of these people with diabetes were able to get off of insulin, were able to get completely off of all diabetes medicines, and maintain normal blood sugars. And their cardiovascular risk profiles reduced dramatically. They also lost a lot of weight. Many of them report feeling dramatically better. Now, at the end of the day, a true scientist will say, well, we want to follow all of them for the rest of their life until they die. And we want to see, do they die early? How would that compare to other diabetics, that were the same age, that had the same degree of diabetes? So those very long-term questions, the reality is we really can't answer those. But also, let me say, we can't answer those for any other diet. We can't answer those exact same questions for the Mediterranean diet. We can't answer those questions for a plant-based diet. We can't answer those questions for a vegetarian or a vegan diet. We don't have data on any diet to be able to answer those questions. And so the fact that we don't have it for the ketogenic diet is not shocking. And it means that the ketogenic diet is a viable option. But given that over a 3-year period, we could take people with diabetes who are at very high risk for having heart attacks and dramatically reduce most of their risk factors, and also dramatically improve their diabetes to the point that they can get off of medication and maintain normal blood sugars, based on everything that we know in the medical field, those are really good things. And so I think it would be foolish for anybody to recommend that those people who are doing well for 3 years on the ketogenic diet, for them to stop it because somehow the diet is dangerous. I think it would be foolish, because every risk factor that we know of is improved in them. So
one of the things we had talked about in the past, it was kind of centered around my personal experience with the ketogenic diet. I had started the diet in December of 2017. I did it for 5 months, 6 months. At the time, I was really overweight. I weighed about 300 pounds, and I lost about 80 pounds during those 5-6 months. And I had struggled with addiction, and I'd had bipolar for a while, and I had never been diagnosed yet. I would soon be diagnosed after this, but after that time of being on the diet, I felt good about myself, so I quit the diet, and I started thinking, I could eat all the sugar I want now because I'm healthy and I'm skinnier, and I was drinking a lot more. And at that point in my life, my addictions went through the chart. I mean, just through the roof. And I went through a 4 or 5 month period that really almost ended my life because of my addictions, and I ended up going to rehab. And I'm curious, is there any correlation between, I had bipolar disorder. I was on keto. It was probably doing some benefit for me. And then I gave up on the diet and quickly went back to tons of sugar and alcohol and saw a drastic change in mood, behavior, and it really had a negative impact on my life. Is there some correlation between those events?
So based on all of the work that I'm doing and everything that we know based on the medical literature, I think there's a good possibility that there could have been a correlation between those events. And, the way that I would look at it is that, even though you were only doing the ketogenic diet for weight loss, it may in fact have had a therapeutic effect on both your addiction and your bipolar disorder. Based on just the neurology literature alone, we know that the ketogenic diet affects neurotransmitter systems in your brain. It decreases levels of inflammation. It actually has really profound effects on brain function in many ways, like a medication does. And so when people are on the diet, especially if it's working for them and they're feeling dramatically better, it is kind of the equivalent of taking a medication that's working for you. And when people then stop the diet, especially if they stop it cold turkey, all hell can break loose. And, certainly the neurologists who use this diet to treat epilepsy see that time and again, that when someone's seizures are completely controlled on the diet and then they go off the diet, their seizures can come back with a vengeance within 24 hours. And in my clinical work that I've been doing in patients with bipolar disorder, with schizophrenia, with chronic depression, I too have seen that when people go off the diet, their symptoms can come back with a vengeance again within 1 to 2 days. Sometimes it takes longer for the symptoms to come back, but they can come back really quickly. And so I think your story at least raises the possibility that that may have happened to you.
And one of the things I've thought about too, or as I've read and heard a lot about, is, maybe I'm not doing the diet perfectly, or maybe I'm struggling to get into ketosis. I've seen a lot of these advertisements for exogenous ketones. I've heard other people out there, doctors, et cetera, talking about experimenting with them. And, I'm curious, these exogenous ketones, or for those who aren't familiar, these supplements that you can take that are said to put you into ketosis, are they helpful, useful? Are they, is it the same as actually doing the diet yourself? Because from my understanding, there's a very short half-life of a ketone in your body. And so taking a pill is nowhere near the same as actually getting into ketosis and changing your gut microbiome.
Yeah, no, it's a great question. The ketogenic diet itself has many different effects on the body. It decreases insulin levels, it decreases glucose levels. It, as you mentioned, it kind of profoundly changes the gut microbiome. And there are some researchers, some very kind of world-renowned researchers who have published in some of the best scientific journals we have on the planet. Some researchers believe that the primary mechanism of action of the ketogenic diet is actually through changes in the gut microbiome. But yet a lot of other researchers are looking at the effects of ketone bodies themselves, beta hydroxybutyrate being one of them. And we know that ketone bodies themselves have profound effects on the brain and the body. And so it's not entirely clear what if there is one magical kind of mechanism of action, or if it really is kind of a whole comprehensive array of different effects on the brain, the body, hormone levels, the microbiome, all of it. If that's really the magic ingredient. So people are doing research on exogenous ketones for epilepsy. They're also doing research. I'm just even recently have been involved with some groups who are interested in studying the effects of exogenous ketones on people with serious mental disorders. So We are hoping to pursue that research to find out, because it is definitely easier to take a supplement than it is to do a diet, especially a really restrictive diet. But to date, I'm not aware of any even case reports showing that exogenous ketones alone, while doing just a regular high carbohydrate diet, have had a profound effect on epilepsy or have had a profound effect on serious mental disorders. Just because something's not published doesn't mean it's not true or won't be true, but we don't have evidence right now to suggest that that's the case. And I can tell you just anecdotally that I have talked to several people who have serious mental disorders who've tried exogenous ketones instead of the ketogenic diet. And for them, at least, they didn't work as well for them as the ketogenic diet itself worked for them. But that's, it's a handful of people, it's anecdotal. So right now we really don't have evidence, but I think we're hoping to get more evidence.
And another kind of a follow-up question there, because we alluded to this connection between the gut microbiome and the brain, and I know from our past conversation that there's as our body gets into ketosis, there's an impact on neurotransmitters in the brain. What is that connection between what we eat and neurotransmitters in the brain, and why is that so important?
So this is one of the hottest areas of research right now, the gut microbiome and its connection to both brain function, but also metabolic disorders more broadly. So we know that the gut microbiome plays a role in causing obesity. It plays a role in type 2 diabetes, plays a role in cardiovascular disease, and we have at least some evidence that it plays a role in at least some mental disorders. So the research in psychiatry is much less robust than it is for those other metabolic disorders, obesity, diabetes, and cardiovascular disease. But interestingly, all of those disorders, those metabolic disorders and mental disorders, commonly run together. So people with metabolic disorders are more likely to have mental disorders, and people with mental disorders are more likely to have metabolic disorders. To get to your question, well, what does the gut microbiome have to do with any of that stuff? It turns out that the microbes in our gut, so there are trillions, literally trillions of microbes in the average human adult gut. And those microbes include lots of bacteria, but they include fungi and viruses. I mean, all sorts of things. And so there are all sorts of different species, thousands and thousands of different species. And they all exist in different kind of proportions to each other. What we know is that those microbes get first dibs at the food that we eat, and they end up turning some of that food into different types of products, like different fatty acids that get absorbed and actually have effects on our brain. They also end up releasing all sorts of neurotransmitters and hormones. And those neurotransmitters and hormones end up getting absorbed into our bloodstream. They travel throughout our body and they affect our endocrine system, our hormones. They affect our brain function. They have all sorts of effects. As you can imagine, when you're talking about trillions of microorganisms and you're talking about thousands and thousands of different species, and then you're talking about like ratios of one to the other, it quickly becomes extraordinarily complicated. And because it's so complicated at this point, that's kind of the state of where we're at, is what I've just said. We know that there's a relationship between them, but we really don't know exactly which bacteria are good, which bacteria are bad, what the ratio of different bacteria should be to each other. We know it's just kind of common sense, and we have plenty of evidence that when people change their diet, their gut microbiomes change as well. The kind of $1 million question is, well, which diets change the gut microbiome in the best ways? And nobody can really say anything about that right now.
So if someone's listening to this and they think, I want to try this diet, they may not know 100% sure why. Maybe for weight loss. It might be for helping with another condition that they suffer from, where should they start? Should they go see a psychiatrist? Should they go to a weight loss clinic that specializes in putting you into ketosis? Should they read a blog post? Should they go listen to a Tim Ferriss podcast with Dom D'Agostino? Like, where's the starting point to learn more about how to use this in your
So
own
I think
life?
it really depends on what the reasons that they want to do the diet. So, if you're trying to treat your epilepsy, you should go to a neurologist and a ketogenic diet center. So there are, I think about 500 ketogenic diet centers around the world now. So if you're using this for epilepsy or a neurological condition, you should go to one of those centers. If you're trying to use this for diabetes, one obvious, easy solution is this Virta clinic. It's a virtual clinic. They will work with your primary care doctor and they will put you on a ketogenic diet. They will help manage your medications. They give you coaching, all sorts of things. So if you're a type 2 diabetic and you don't have a local physician who's using the ketogenic diet, I would say Virta clinic, at least check it out. If you're using this diet to treat a serious mental disorder, I do think that people really need to, like, required. It's required that you work with a psychiatrist or a nurse practitioner. And the reason that I say that is because the ketogenic diet is a really powerful intervention, but schizophrenia, bipolar disorder, severe depression with suicidal thoughts, those are really dangerous, serious, life-threatening disorders. And when you use a powerful intervention against a dangerous disorder, you kind of need to know what you're doing. And and it shouldn't, treating your life-threatening psychiatric disorder should not be a do-it-yourself project at home.
Yeah. Yeah, that's I guess that's really a good point. It kind of makes me wonder about other diseases. I mean, has there been work done around this diet or any diet having an impact on things like Alzheimer's or cancer or other serious diseases?
Great question. And yes, there is work being done on this. So there's some research showing that the ketogenic diet can slow the progression of some types of tumors or cancers. I am not aware of any cases of cure. So a lot of times people are looking for a cancer cure in this diet, and at least right now I'm not aware of any cases of cancer actually being cured by using the ketogenic diet. But there are some studies, even some controlled studies, that have looked at the use of the ketogenic diet for some types of tumors. I my understanding of the field as it is right now is that some tumors don't seem to respond to the ketogenic diet, yet other tumors can respond really well. And when I say respond, it means that the growth of those tumors slows. And so most oncologists who are interested in using this diet are using the diet as an adjunctive treatment to standard cancer treatment. So while they want to slow the progression of the tumor to keep you alive as long as possible, and that then gives them an opportunity to see if they can cure the cancer with a more aggressive treatment like chemotherapy or radiation or surgery or something else. And so there are trials underway now of the ketogenic diet and its use in cancer treatment. In terms of Alzheimer's disease, that is an emerging field right now. So there's been evidence over the past 5 to 10 years that Alzheimer's disease appears to involve problems with glucose metabolism in the brain. And some people are referring to that as type 3 diabetes. And one of the things that the ketogenic diet is kind of really obviously good at is it provides an alternate fuel source to brain cells. So if the brain cells in patients with Alzheimer's disease, if the brain cells aren't getting enough fuel from glucose, the ketogenic diet on one level kind of makes perfect sense because it's providing an alternate source of fuel. And that alternate source of fuel can get into those brain cells much more easily than glucose can. And so we've had actually several animal studies with mouse models of Alzheimer's disease showing that the ketogenic diet can have an effect. It can slow the progression. It can even help clear out the plaques and tangles that are characteristic of Alzheimer's disease. But there are at least 2 clinical trials that I'm aware of, randomized controlled trials, one at Johns Hopkins and one at, I'm forgetting, I think it's not Case Western. Another university. And both of those trials actually showed that the ketogenic diet, for the people who were able to do the ketogenic diet resulted in an improvement in the biomarkers of Alzheimer's disease. One of the studies showed that it improved cognition in just 6 weeks, and it improved energy levels in just 6 weeks. Now, here's the caveat. The study that got done at Johns Hopkins, they screened over, I think, 1,300 people. It may have been even more than that, but the last I heard, they had screened over 1,300 people over a 2.5-year period. And they ended up only getting 14 people to actually complete the trial. So that's pretty disappointing and pretty dismal as a treatment, because even if the ketogenic diet can be a powerful intervention for Alzheimer's disease, at the end of the day, we have to get people to do it.
That's interesting. Why do we struggle to get people to do it? Is it just because it's such a hard start or such a drastic change? Are our brains somehow subconsciously resisting this change to the alternate fuel source? I mean, what makes it so hard?
So I think the biggest thing that makes it so hard, there are a few things that make it so hard. So one is, I think, one big thing is that so many people are naysaying this diet. So if you read the popular press, you'll read some articles that are favorable to the ketogenic diet, but you also read a lot of articles that say, this diet's going to kill you. Don't do this diet. It's dangerous. Don't do it. It's crazy. And so that alone is going to discourage people from really trying hard to do this intervention when they're kind of scared that they're killing themselves. And this diet goes against the grain of everything that we've been taught is a healthy diet. So this diet emphasizes eating a lot of fats. Most versions of this diet say saturated fat is fine. So that means red meat, bacon, butter, those things are all fine. And so most people who aren't familiar with this diet, at first glance, they're like, this can't be good for me. This has to be unhealthy. So right off the bat, a lot of people are skeptical, they're hesitant, and so they might kind of give it a half-hearted try. The second reason, which is probably the bigger reason in reality, is that the first week or two of this diet, in particular the first 3 to 4 days, but usually I say the first 2 weeks, this diet is extraordinarily difficult to do in that first couple of weeks. And the reason is because your body is going through this very dramatic, powerful shift in fuel sources, and it doesn't like it. I will just say that for the record. Your body does not like change. That's a really adaptive response on the part of the human body. It doesn't like change, and it resists change. And this is an extraordinarily powerful change that affects almost every cell in the human body. And so what do I mean by that? I mean that when people are first starting this diet, they will feel extraordinarily hungry. They will feel irritable. They might feel weak or dizzy or lightheaded. People with pre-existing depression might actually feel more depressed when they first start this diet, at least in the first few days. People with other disorders, even people with epilepsy, sometimes the seizures can get worse before they get better because of this transition period. And so when people try this diet, so if I think about, an elderly couple, one with Alzheimer's disease and the other spouse who's doing their best to take care of this person, and they go to Johns Hopkins for this study, and they get put on this ketogenic diet, right off the bat, they're probably thinking, this sounds like a crazy diet. This can't be very healthy for me. And then 2 days into the diet, the person's feeling weak, dizzy, lightheaded, nauseous. um, they're going to come to the conclusion, oh my God, see, we were right. This is a dangerous diet. This is crazy. We're not doing this diet. Let's go eat some toast. And they're done. And so I think what we really need we need clinicians and clinics and other practitioners, dietitians and other, nurses, a whole range of medical professionals who understand this diet, who understand the complications, who understand this kind of keto adaptation or phase, that things can get worse before they get better, but also that understand the art of doing this diet. And what I mean by that is that, sometimes people are like, oh, I really want my ice cream and I crave ice cream and I can't have ice cream on this keto diet. So I'm going off the diet and having ice cream. So part of the art is knowing, well, actually, no, you can have ice cream. It's special. It has to be specially made ice cream. It's got to be ketogenic ice cream, but you can make it. It's actually pretty easy to do. You can make it in your home. It's made out of heavy cream. You can turn it into chocolate or vanilla. It can be ready in 3 or 4 hours right in your freezer. And it tastes pretty good, but you have to know that. And the people working with them need to know to tell that to these people that, wait, no, if you're really craving ice cream, that's easy. We can manage that. If you're really craving something crunchy, that's easy. We can manage that. And that gets into the art of, kind of the art of medicine, but in this with this case specifically, the art of a dietary intervention. How can we make it palatable for people? How can we make it doable? How can we work within the restraints that they have? Different people are on different budgets. So some people will say, oh, I only eat grass-fed beef or grass-fed organic beef. Well, grass-fed organic beef is really expensive. And if you're on disability and, and you get food stamps, I hope you're not spending your money and your food stamps on grass-fed organic beef because you're going to starve to death. like that. So part of the art of working with people is understanding their budget, understanding their different tastes, understanding their culture, understanding the other people that they're kind of interacting with and what pressures those people are putting on them to eat certain foods or not eat other foods or whatever. And so it really ends up taking people who are skillful and knowledgeable about all of this to really implement it in a safe and effective way.
One of the things you mentioned in a question I've always tried to explain to my friends, but I don't do as well with it, is what's going on in my body that makes me have that lightheaded, weird feeling in the first week as my brain switches fuel sources? Like what's going on as my body moves from relying on carbohydrates and sugar to fat?
So I actually, there's a lot of controversy about this. So some people in the ketogenic community think that it's related to electrolyte deficiencies. And there's no question that electrolyte deficiencies can happen in that first week, and they can actually make people feel ill. So for some people, it can be that. This diet ends up being very dehydrating in the first 2 weeks. You're losing a lot of your body's glycogen early on. And with that glycogen, you're losing water. And then with that water that's coming out as urine, it's taking a lot of electrolytes with it. And so certainly early on, and for some people even continuously, it's important to think about supplementing sodium, potassium, magnesium, because those are often being depleted. So sometimes it's as simple as that. I actually think for most people, it's more complicated than just electrolytes. I actually think it relates to this switch in fuel sources. When somebody has even a mild degree of insulin resistance, What that means is that glucose is having a hard time getting into cells, including brain cells, or at least some brain cells. And the easiest way to override insulin resistance is to increase your glucose levels and to increase your insulin levels. And if you increase both of those levels, the glucose will be able to get into cells more easily. And the easiest way to increase your levels of glucose and insulin is to eat a lot of carbohydrates. So that's why people do it. It works. It's a really effective way to get more fuel into your cells. And so when you go on the ketogenic diet that first week, what's happening is that your insulin levels are plummeting and your glucose levels are plummeting. And if that insulin resistance is still there, which it will be because it doesn't correct itself in 2 days, it takes a long time for that to correct itself. So if that insulin resistance is still there, it means that the cells in your body and your brain are relatively energy deprived as you're going through that keto adaptation phase. So that's really important to know that that it can get worse before it gets better. As the ketone levels begin to rise and as your body starts to adjust and adapt to the diet, those symptoms almost always do go away and they get dramatically better. And, within 2 to 3 months of doing this diet, most people, if they can stick with the diet for 2 to 3 months, most people will say they feel dramatically better than they did prior to starting the diet. A lot of people will report feeling they have more energy, they have more motivation, they're able to concentrate better. They still get hungry, but not in the way that they used to. Like they get hungry around meals. They can eat a reasonable sized meal and feel full and feel satisfied. And they're less tempted to overeat or to kind of snack or eat out of stress. But you have to get through that keto adaptation phase.
And one other question that comes to mind for me here is that are there people that are working against the keto diet? I mean, I feel like the pharma companies, they want to sell pills. They don't want us to find a diet that cures our problems. Is that like too conspiracy theory of an idea?
So to answer your question, are there people working against the ketogenic diet? The unequivocal answer is yes. And the most obvious sources of that are, there are medical professionals who in their heart of hearts really do believe that saturated fats are toxic to the human body and that people will drop dead of heart attacks or strokes if they go on this diet. And so those medical professionals, I think, they have good reason they don't have good reason based on evidence, but they've been taught this their whole career and they haven't bothered to challenge it. They haven't bothered to take a fresh look at the evidence. They haven't bothered to take a look at the evidence that got reanalyzed, that at one point came out with the headline, saturated fat is bad for you. And now when they've reanalyzed the data, it actually says, well, wait, no, actually, maybe maybe that wasn't true. But there are a lot of medical professionals who I'm not I'm here to try to kind of understand them. They're good people. They're doctors. They want to save lives. In their heart of hearts, they think this diet will kill people. So they're vehemently against this diet. I respectfully disagree with them because I don't think they understand the science in the way that I understand the science. And I welcome opportunities to have conversations with them to really look at the evidence and look at the science and look at things like the Verta study that really fly in the face of current dogma. So I'm hoping to slowly but surely be part of a movement that changes their minds. But, they're not bad people. They really do care about human beings and they really want to save lives. And so they come out vehemently against it. there's a whole plant-based dietary movement right now based, and there are different reasons for it. So, there's always been a vegetarian vegan kind of community. And so some people are against eating animal-based products, which the ketogenic diet tends to be very high in. There are some people who are against it based on ethical reasons. They don't think that cows and pigs and chickens should be killed as food for humans. There are other people who believe in plant-based diets for religious reasons. The Seventh-day Adventists believe in primarily a plant-based diet based on religious reasons and their biblical understanding of what diet God wants us to eat. And there are other people who are in support of a plant-based diet for, the latest thing is the environment, that, animal-based foods somehow contribute more adverse effects to the environment than plant-based food. The reality is that when we have an obesity epidemic and a diabetes epidemic, there's no question. Somebody who's obese and diabetic is having a much more profound adverse effect on the environment based on all the pills that they're taking, based on the resources they're utilizing, based on the amount of food they're eating, based on the lack of productivity, based on all sorts of things. And so, just looking at it from a pragmatic standpoint, if the ketogenic diet can be an effective intervention for those people and can help them lose weight, get off of diabetes meds, eat less food overall because they're less hungry, maintain a normal weight, be more productive in their jobs, all of that kind of stuff, that would really be environmentally friendly, even though they're eating an animal-based food diet kind of pattern. But those are kind of some of the groups that are anti-ketogenic diet, for better or worse.
So what about for you? Do you exercise the keto diet in your day-to-day eating habits? And if so, how long have you been doing that?
So I do. I started doing a low carbohydrate or ketogenic diet probably 23 years ago. Low carbohydrate diets aren't always the same thing as ketogenic diets. So, as a rule of thumb, my diet tends to be low in carbohydrate. And, fairly often it ends up also being ketogenic. So, I started it 23 years ago for my own personal health reasons, that I was, only in my late 20s, but I was already developing metabolic syndrome. I had high blood pressure. I had bad cholesterol readings. And my primary care doctor was trying to get me to go on medication. And I was pretty disciplined. I really technically was not overweight, and I exercised pretty regularly. But I was on a very low fat diet because at the time that was what was recommended. And what was recommended was the lower the fat, the better. And it turns out we now know that was a really awful recommendation. And it was actually certainly catastrophic for my own personal health and likely catastrophic for a lot of other people's health too. But unfortunately, the nutritional field hasn't changed much. They still continue to make recommendations based on the same type of science that allowed them to make that kind of an egregious mistake. But anyway, so I kind of defied the medical profession in a last-ditch effort and went on the ketogenic diet. And within 3 months, my metabolic syndrome was completely reversed. I had a very low healthy blood pressure. My HDL increased, my LDL decreased, my triglycerides decreased, everything that you would want improved. And so I've never looked back. I've remained on a low carbohydrate or ketogenic diet for the last 23 years. And I am, by all measures, healthy. I don't have high blood pressure. I don't have bad cholesterol readings. I don't have any kind of cardiovascular risk factors. I don't take any medications for those things. I'm in my 50s. And so that kind of makes me an outlier right there, being in your 50s, not on any medications for all of those bad things that kind of are ailing society. And I largely attribute it to low carb or ketogenic diets.
And, if I'm looking around out there, if I'm a listener and I'm wanting to know how to get smart here. Where do I go? For me personally, I first learned of the diet by listening to a Tim Ferriss podcast with Dom D'Agostino and a couple of others that he's had on to talk about this over the years. And I read up, and then I went to a clinic and I got help managing the diet there. But where does someone go to read more? What are good resources that aren't going to feed you misinformation?
Again, I think a lot of it really depends on what your goals are. So if you're looking to lose weight, the resources you mentioned, Dom D'Agostino, others are good, solid resources. If the Verta Clinic, again, I'll plug them because they're very science based. And even if you just go to their site, you can get a lot of the science. Whether you want to use them as a clinic or not will be up to you. I think if you're using this for epilepsy, again, a very different story. Eric Kosoff is a neurologist at Johns Hopkins. He's one of the world's leading authorities on this diet. John Rowe, Jong, and Rho, Rowe. So he's a neurologist in San Diego who has done a tremendous amount of work on the mechanisms of action of this diet. So both of them are really reliable resources in terms of using this diet for neurological disorders. I have a website, chrispalmermd.com. People can learn more about the use of the ketogenic diet in psychiatry there. But you're right. I mean, there are a lot of websites out there run by people who don't necessarily know what they're talking about, making all sorts of claims or giving misinformation. And it's really unfortunate because people need accurate health information.
Well, I will link to everything you just mentioned in the show notes so that people can find those resources easily. And this has been really informative. It's been helpful for me to hear you explain some of these concepts. And I think our listeners will get a lot out of this. So I'm really grateful for your time today. For everyone listening, I hope that you will check out Dr. Palmer's website, his resources, follow him on social media, and stay abreast of his research because he's really doing a lot to change the course of human history and how we manage our minds and our mental health with the things we put into our mouth, which is a topic that, while it sounds somewhat basic, it's really a new concept. So thank you so much for being here. Really, really appreciate it.
Thank you, Stephen. It was my pleasure.
So thank you again, Dr. Palmer, for being here. I just wanted to, I can't express my gratitude enough. It's really important to me personally to hear you talk about these things because they're relevant in my life as I live with bipolar and as I live in recovery from addiction and as I try to adhere to the keto diet for a number of reasons, weight loss, health, but also for mental wellness. To our listeners, thank you for being here. We're really grateful to have you. If you like our episode and you like our content, we'd be extremely grateful to have a like or a subscription or a rating on your podcast platform of choice. And more importantly, we want to hear from you. Please reach out. Tell us what you want to hear on the show. React to something you heard here. Reach out to us on Twitter. You can connect with us at StigmaCast on Twitter. Our website is stigmapodcast.com. We really do want to hear from you. So thank you for being here. And until next time, stay safe.